Thank you very much, Chang. I appreciate the introduction. So as mentioned, my name is Robert Piasentin. I am a partner with McMillan LLP based here in Vancouver. For those of you who don't know, McMillan LLP is a full-service business law firm. We have lawyers who cover everything you might need when you're starting a business all the way to exiting a business and everything in between. My role is I'm a partner in the technology group. I lead our technology practice nationally, and I work a lot with small companies, startup companies, emerging companies as they grow, and we help to develop them and bring them into, provide them the legal advice that they need in order to make their businesses as successful as possible. And so I'm really happy today to be able to sit here with Jessica. And perhaps, Jessica, maybe Chang gave a great introduction on the business, but do you want to give a few words about yourself in terms of how you got to where you are right now?
Hello, everyone. I'm the CEO of Gene BioMedical. Gene BioMedical is from groundbreaking, provide a rapid diagnostic solution during the pandemic. We're the key supplier of the Canadian federal government during the pandemic. Post-pandemic, where becomes a primary commercialization business partner with 5 innovation hubs to be preparedness pandemic program. So very happy today I'm sitting on the stage with Rob to chat about what has happened during the healthcare crisis and how do we solve the problem and then continue to do the innovations in the futures. Thank you, Rob.
Thanks, Jessica. So as we heard, Gene BioMedical as a company is a top diagnostic solutions provider. Can you provide sort of a description of sort of the first products or services that the company offered and how it's evolved over time to get to where you are today?
So Gene BioMedical, we built the company in 2021, but we started research when the pandemic happened in 2019. In the really early stage, we found the 0 patient samples in Asia. And then so in the early stage innovations, we consider the upstream and then downstream, providing the solutions with low cost, higher accuracy, the diagnostic solutions. At the beginning, we offer the manufacturer services to other companies to provide the diagnostic solutions made in Canada. We take over 6% marketing shares made in Canada at that time. So during that time, almost 57% marketing shares were imported from other countries like US and Asia. 27% was imported from South Korea. Only 7% made in Canada. Gene Bio produced 6% in the rapid test, and then 1% made by LAMP Diagnostic Solutions. So we have a massive potential marketings for the diagnostic solutions. This is how that works during the pandemic.
Excellent. Thanks, Jessica. So starting during the COVID, or the beginnings of the company began in the COVID sort of era, were there any sort of key or pivotal moments or decisions during that phase that significantly impacted how the company would grow and develop over time?
Yeah, the key components that is include what is the streamline of the innovations. So to choose the specific N protein, as you know, the innovation, and as you know, the COVID-19 viruses is called the SARS-CoV-2. That is based on the SARS viruses variant into the SARS-CoV-19s. So the spike proteins that is create a lot of variant and then keep going. So the recent report saying over 30,000 variant COVID-19 has been found all over the world. The most majority variant strains, the WHO use alphabet to rename of them: alpha, beta, gamma, omicrons, and the delta. So Gene Bio, when we choose the targets and we choose the N proteins, that is include 5 important domain, and then this is that's why we in our technology we can identify over 40 different variants in the COVID-19 virus, clonal viruses. So improve that sensitivities. Also, we consider the lower the cost that compare with the PCR. Also, we consider of the pandemic compare with the country's populations. So that's why the rapid point of care that will be release the pressures of a healthcare crisis.
Thanks, Jessica. And then, given the beginnings of the business and the idea in the COVID era, and so we're out of the worst part of the COVID pandemic at this point in time. But how have you continued to sort of grow and develop the business as the pandemic issues have changed? As COVID has mutated into other ways, or whatever. Have you sort of stayed on top of all of that, and how have you kept the business relevant through that stage?
So COVID is a long-term COVID issues. As I mentioned, the COVID viruses keep variant. To keep the reagent, giving the correct diagnostic decisions to healthcare providers is our mission and a response. So to give a more accuracy result to help release the healthcare crisis, that's our responsibility for developing the diagnostic solutions. And we also, the technology can be used in the clean tech field, agriculture field, and the environmental pollution field. So that the technology is provide the innovation solutions.
Now, a big challenge for all businesses as they're growing, they're developing, and especially in a fast-paced environment, like when you're dealing with something like the COVID pandemic, is the protection of your intellectual property. And so, IP, how to make sure you actually have control, ownership, the ability to actually commercialize what you're doing, so that the business can profit from the development, the research, everything you're doing. Your business has achieved positive net present value as a result of a very robust IP portfolio. Now, were there any significant challenges or legal issues or other issues with respect to your intellectual property generally that the company faced that you had to overcome from the start till now?
That's good questions. So develop the IP in the really early stage. That is the most important parts. For the development, the new key components, marketing demands, also the commercialization supply chains, that's also created the IP portfolios. So Gene BioMedical consistent to create IP portfolios include trademark, trade secret, copyrights, and then the industry designs. That is created also to work with the IP firms. That's very important to get a more early stage coaching to understand what is the regulation times, what is the IP protections. That's the most important to helping us achieve the positive IP net worth. Thank you.
And did you have to make decisions from a costing perspective? Because to take the steps necessary to protect your intellectual property, there is costs involved in that. Did you have to balance sort of what was more important in terms of the development of the business from protection of IP versus research versus commercialization versus, anything? Were there any difficult decisions you had to make in that regard?
The financial balancing definitely is very difficult. To develop the IP, that's a long-term journeys. Also to help us to understand the whole process to get the regulations. So Gene BioMedical gathered the regulate from the Health Canada authorized in last year, August. So it takes us at least 2 years get approved, list on the market. So to push the products on the market, the timeline is very important. We have a greatest innovations in Canada, genius ideas and great innovations, but the timing to get into the market, that's also very efficient.
And what was the process that you followed at Gene BioMedical with respect to developing, protecting, creating your IP and the portfolio with respect to, say, things like patents, trademarks, you mentioned trade secrets? Did you have an internal process to sort of elaborate those technologies, go out and actually protect them from there?
The most our IP portfolio right now is protected by the trade secret and know-how, because the diagnostic method, diagnostic patents that include the research patents, utility patents, industrial design. The rapid test, the diagnostic solutions, somebody's already registered the patents, but to specific targets and proteins, it's taking a long time to register the patents. But somebody who bring the products already on shelf, that is also protect us of the IP portfolios.
And related to that then, from an international perspective, because obviously you're a local company, but you're operating, you have deals and relationships with partners around the world. Did you have to take steps to work on protecting your IP on an international scale?
Yeah, so the international market does need the different regulation procedures. So for the Europe market that need the CE mark, to enter the U.S. market that need the FDA approved, and the Health Canada, the Canadian market is Health Canada approved. In the other countries that need a different market to entrance. So understand the regulation process, register the trademark to protect our safeguard of the IP. That is what we're doing right now.
Were there any challenges with the protection of your intellectual property where you had to sort of avoid particular jurisdictions or reconsider how best to go about protecting your IP as the business grew?
Yeah, so develop the medical device that is we have to navigate the legal issues. So in Canada, we have a Canada Health Act and then the Medical Device Act to understand the diagnostic solutions, which class will belongs to. Medical device in Canada, we have a class 1 to class 4 in the different levels. The highest class means the highest risk, because in the diagnostic solutions, usually we coding the biomarkers, that is a higher risk, and also giving the result, the diagnostic result to the healthcare providers. It could be, it's a big challenging and a big responsibility to give the decision to the healthcare providers. So when we develop the biomarkers, we have to consider the long-term steady solutions for the long COVID or any other infection diseases.
Thanks, Jessica. Now, shifting gears a little bit, when you were growing the business, did Gene BioMedical employ any unique or unconventional sort of growth strategies that were more or less successful for the business? Did you find some things that worked better and some things that perhaps you realized after the fact were not, perhaps not the right approach for your business?
I think Gene BioMedical currently is facing the capacity challenges. We produce over 50 million testers during the pandemic, but we stuck at capacities. So that's why the most diagnostic solutions in Canada, we have to import from other countries. And Canadian government, before the COVID, Canadian government spent over $5 billion every year annually to import the diagnostic solutions from other countries, such as a PCR, ELISAs, or rapid test. And then during the pandemic, we only take domestic, so 6% marketing shares. We definitely have rooms to improve our services.
And you mentioned the capacity issue, and during the COVID pandemic and then after, there was a serious supply chain issue for a lot of industries. Everyone was being impacted by it. You guys, Gene BioMedical, you sourced a lot of key supplies, notwithstanding those significant supply chain issues. What type of solutions did you introduce to sort of address that particular risk in terms of how do you get the supplies when you need them in order to actually service the market into which you're providing your products, and what sort of approaches or technologies did you learn or develop as a result of that exercise?
That's actually very challenging. When the pandemic happened, the supply chain issues always have a higher challenging for us, upstream and downstream. Those plastic cassette or the paper box, everything shortage. So to connect with all of the suppliers or strategic business partner globally, share the data, so share where those supplies, how long to ship overseas to Canada, to estimate the timeline, also push our manufacturer to produce the products, deliver to our clients. That is what the Gene Bios do. So we did a pretty well job to immediately deliver the supplies during the Omicron's explode. So that's why we have a wild connections. We have a strategic partners globally, 120 business partners, upstream and downstream, that to understand each other, what is the demands. So share the marketing strategies, share the informations to each other.
Well, I think one of the key success points for Gene BioMedical was the ability to be a lot more efficient from a supply chain perspective in an environment where supply chain issues were very challenging for a lot of businesses. And in light of that, and in light of the COVID-19 pandemic and everything, what would you normally suggest, or what would you advise, rather, businesses when they're trying to build the resilience in order to deal with whether supply chain issues, but it can apply to other areas of their business as well, to have that resilience in order to face future crises and deal with any challenges they might face?
I would suggest to do the marketing research in the really, really early stage innovations to understand the key components, what is the marketing demands, and the IP portfolios protections. So this will cutting off more time to achieve the successful.
And so in terms of the establishment of, as you're going through all those challenges, from a financing perspective for the business itself, did you have to go out and secure financing from third-party investors, or how did you sort of build that side of the business to ensure you had the financial wherewithal in order to continue to grow your business?
At the beginning, we're funded by the family and the friends' support. Everything comes really fast. We don't even have a time to go raise money. So we passed the best time to approach the seed or angel investors. So the company grew rapidly during the pandemic. And then the post-COVID, we're focused on the cutting-edge novel technology to provide better diagnostic solutions, increase the sensitivities, and then lower the cost. That is our focus. So we collaborate with a lot of universities, institutions, and the other business partner globally to innovate the newer technology. So we're expanding the business, shift more in the innovation side, also help a lot of other early stage company, guide them how to understand the market and the regulations of the medical device. So that's the Gene BioMedical right now is a co-investment with the government and then the institutions to build up the pilot manufacturers in domestics. So we are more focused on the provide the prototyping services, early stage innovations in the research center.
Now, a lot of businesses, as they're growing, and especially the way you described Gene BioMedical grew very quickly because of circumstances that around what was going on with the pandemic. What did you find were perhaps some of the biggest challenges you faced? A lot of times when you're scaling up that quickly, it could be resourcing from employees, making sure you have enough people. But what were sort of the biggest issues that Gene BioMedical had to overcome during that growth phase?
The timeline is our challenging to register the patent, or even though the industry design patent, that is also causing time. So that's why we have two top lawyer firm. One is an IP firm to give us the guidance. Another is a corporation structures firms, law firms, to give an insight of how to create the critical goals for create IP portfolios.
And given the rapid growth, and then you mentioned that things grew so quickly that you didn't actually have an opportunity to go for seed financing or anything like that. Is that something now as part of your strategy? You're sort of thinking, okay, what do we do going forward to continue to grow the business, to scale it to the next level? Do we need to bring in investors, or like how do you sort of assess that from a business perspective to maximize the value for Gene BioMedical?
Yeah, absolutely. We do need bring the strategic investors in our group in order to expand the business in the futures. We have 4 new innovation on our new pipelines. That is also will welcome the investors to participate in the companies, to grow the companies, to grow a real research biomanufacturers in Canada. That is our plan.
And related to that, I guess, as well, would be things like partnerships with third parties, whether local or international entities, that'll help you sort of be strategic in the growth of your business. Can you speak to the advantages that you have found of partnering with similar companies in the industry, and how Gene BioMedical has managed to build those relationships over time?
At the beginning, we provide OEM, CDMO services to other companies because our own development haven't got authorized yet. But we found to share the marketing information, that is very important. I think it is a benefit to connect with all of the industry business partners to understand the marketing demand, also the delivery, the capability to the market. That's the key components.
And were there any strategic partnerships or collaborations that were essential or fundamental in sort of the growth? I know you mentioned earlier relationships with like Health Canada or their corresponding partners in other countries because you had to be licensed or regulated by them. But were there any sort of those types of strategic partnerships or collaborations that really helped Gene BioMedical sort of push through to the next level?
The Health Canada, they're the agency to approve those products for the regulations. There's one program in really early stage. You can bring your idea or components to ask to get a consultant from the Health Canada. They won't tell you how successful you will be, but at least they will give some guidance. This is feasible for applied medical device, which levels at least you can understand. For us, at least we can understand quickly what is the policy and how long for the timeline of the regulations. And another collaborations with Gene BioMedical is NRCH, the National Research Council. So they're encourage the domestic innovations that is made in Canada to keep the IPs in Canada. So they're giving the match fund to support the early stage innovations, and then they encourage the commercializations in Canada. Yeah, so those national nationwide councils will helping us a lot to navigate. The third one, the business partners, is public health authorities. So public health authorities give the guidance what is their shortage. So for medical device, we always have to import from other countries. So we get the shortage list. We understand what is the government purchase agency demand. That's why we're providing the cutting edge novel technology, lower the current cost for the shortage supply demand. That is can really help our healthcare's medical supply chain issues.
Excellent. Thanks very much, Jessica. I think we're close to start the question. I just want to make sure it's hard to see you guys over there.
There's a lot of questions.
Okay. So perhaps we'll get into the questions now then, because it's probably a good time. And so the first question, Jessica, is startups often struggle with scaling very fast. What was the single biggest challenge for you to grow so quickly as a company?
Yeah, so thank you for the first questions. The biggest challenging is for the balancing the financials. So because when we do the innovations, we have no fundings. So all the fundings have to come from the family's support. Yeah, so because this is, I have over 15 years experience. I experienced the last pandemic SARS, so that's why I can act so quickly. But for the normal innovations, the financials issues, that will be causing a long trail for the normal companies to innovate a new technology.
Another question, which is, did Gene BioMedical start up in a research institution or in a biotech incubator? And if not, how did you actually develop your technology and intellectual property from there?
We start up at a research group. We're funded by the whole bunch of scientists group. We did our phase 3 clinical trial in Denmark in 2021 September's. So our kickoff the market is in the European market, and then we come back to register the Health Canada in 2022 August.
Excellent. How did Gene BioMedical gain access to patient zero in China for the COVID pandemic, and which probably would have given you a great advantage in developing your product? So how did that come about?
Yeah, we collect the samples, 0 patient samples from China, but for the other samples, we bought over 40 different patient samples globally. So for alpha, beta, gamma, and delta, and Omicrons, those samples were from everywhere in globally, not just in China, but the first patient, 0 patient samples was from China.
What is the inspiration for you and your co-founders what was your inspiration to start up Gene BioMedical? And what's your long-term vision for continued success?
My team has great talent, scientist, financial expert, and then the digital health expert. One of the co-founders was pay by phones guy. Last time he gave the presentations here too. So we want to provide the digital readable devices in the futures. So ChatGPT, AI really bring a lot to our communities. So also we want to have the revolutions in the medical field as well. So this is in the futures, Gene BioMedical keep developing more digital medical devices to the diagnostic solutions.
Excellent. And So what challenges did you face in funding the enterprise during its early stages? You mentioned you had friends and family as the primary thing. How do you think those challenges would be overcome, and what might be different in today's market, given the changes in the environment since the beginning of the COVID pandemic?
It is very challenging last year because the primaries been really, really high last year. So it is very challenging for Gene BioMedical to raise money. The most challenging is how to do the valuations. What is the values of the companies? So most biotech company, they're pre-revenues, we're post-revenues. How the investors see the values of the companies, that is our facing the challenges.
All right. You also, Gene BioMedical produced over 15 million testers during the pandemic itself. How many are you producing each year now, and where else are you making up for reduced production?
So Gene BioMedical producing 50 million testers during the pandemic. Right now, we're producing the home use, self-use, under Gene BioMedical's brand. It's called the Sweep Swab. So we use different technology, targets the N proteins, which is can detect over 40 different variant the COVID-19 viruses. So right now, our self-test is already on shelf. People can purchase, easy access. So right now, the marketing is in Quebec. Those free testers already, the federal government, they stopped to purchasing. The pharmacies start to put on the shelf. People start to buy. So the diagnostic rapid test is for right now. We educated the market. More and more people understand how when they have symptoms, they want to test, and then they want to understand what kind of viruses they're catching. Do they catching COVID-19s, flu ABs, or RSVs? So that's give the decisions also to healthcare providers or pharmacists, either what kind of medications can give to the patient, where they give to the antibiotics, or what kind of medications to focus. So for keep going tracking our reagent to test a variant, that is our responsibilities.
Would you be able to comment on the holistic health sciences industry generally and see how that sort of impacted your business as you've grown along? Just give up the screen. So the question just dropped from our screen. So there it is. It's back. Okay. So the first one. So comment on the holistic health sciences industry in Canada, and what areas of development do you recommend for the ecosystem?
Right now, we are Gene BioMedical belongs to it's called the One Health communities. So those scientists, physicians, and then with healthcare providers, we share the datas and then the update infection diseases informations. So what is area? Okay. So so there's a lot of newer technology happened in BC. In BC we have a great biotech companies that is helping to stimulate our ecosystem. So in diagnostic field, we are more right now. I see a lot of demands on the animals study, animals infection diseases. That is the most popular development right now.
And do you find the talent and skill sets that you need locally in BC, or did you have to go beyond BC to find the skill you needed?
we have a great innovations in BC. The only challenging right now is we don't have too many skilled workers to understand the GMP and somebody who's familiar to work at the GMPs. So I encourage the universities to have a manufacturer training program, quality control assurance program to training the student. After they graduate, they can get into the manufacturers. At least they know how to operate in the machines, understand how to write the SOP, follow the SOPs. So we moving forward the training program and do some consultants to the other companies. But we want to introduce the program also to the institutions as well.
Another question is, we understand the life cycle in the research and biomedical fields are quite long. How long did it take Gene Biomedical to do that? How did you deal with the time period for getting the approvals and everything you needed?
Oh my God, I was running really fast during the pandemic. My team worked 24 hours, 3 shifts. We hired over 300 people working in the manufacturer. It's very very challenging. And then right now I cannot stop. I still sleep at 2 a.m. Yeah. But I keep learning. I keep learning a lot of new informations. I attend a lot of bio event in globally. I went to UK. I went to Boston. And then Germany in November, South Korea, Thailand in December. So I want to know what's happening in other countries, how to benefit to our country, how to protect our peoples.
We're almost at the end of time, so I'll ask one last question, and then perhaps we'll wrap it up after that. And this one is, you mentioned collaborating with university research teams. How do you help university innovations to be commercialized?
Yeah, this is what we do right now. So a lot of researchers, they need to understand what is the marketing demand. So that's why we collaborate with the universities, researchers. We give the data analyst, we're giving the data analyst of the marketing demand, what is the research directions and what kind of components, what is the marketing's looking for, the solutions, and then estimate the cost. So they can have a clear direction for the innovations. That's the current what we're doing with the 3 universities.
Well, that's excellent. Thank you very much, Jessica. I think we learned a ton about your business and about you, but this is brilliant. Thank you very much. Thank you to
everyone.
UBC for hosting this. This was excellent.
Thank you.